Welcome to JPHMP Direct Talk, a podcast series bringing you conversations that bridge the gap between research and practice. In this episode, Dr. Gulzar Shah, consulting editor for biostatistics for the Journal of Public Health Management and Practice, and host of the new JPHMP Direct series, Health Informatics Innovations and Applications, is joined by Dr. Zahid Butt, CEO of Medisolv Inc., and Mr. Mark Renfro, Executive Director of HealtHIE Georgia Corporation, to discuss informatics silos and the potential role of informatics to incentivize partnerships between healthcare and public health.
What would you say are some of the emerging topics?
I think for me, interoperability
Of
the patient data. How do you share the data with the public health agencies from the care delivery sites, whether it's physician's office or hospital? How do you interface the public health side?
Okay, so where are the difficulties? Are they having to do with inability of the public health agencies to receive those?
So that is part of it.
Part of it?
Yeah.
Is it
Part
will
of it.
mostly, or is it the lack of infrastructure? A lack of will or lack of infrastructure?
The will part, I don't know. I don't circulate in those.
The will I would replace with money. That's one of the issues. So the will is money driven. And the other part of it really is the fact that, they just have not been pushed at this point to incentivize. And that's one of the things we've seen with the public health departments. And we're, right now working with some of the CSBs, which is community service boards. They right now are just getting into electronic health records, and they are going from what I call a paper silo to electronic silo. So interoperability, once we get to the electronic silo, we've got to build the interoperability. Our focus has been today between hospitals and physicians. We need to expand that to all the other areas within that. The nursing home, the CSBs, the public health department, everybody in that community needs to be, as you said, interoperability or integrated within that community. So,
How does it hurt? Or what's it? Is it worth the monies for them to make it interoperable, and whose money it should be?
So health department right now, from a data standpoint, is a roach motel.
Okay.
Data just goes in, it never comes out.
Yeah. That's a good one.
Especially for the providers, right?
Yeah.
So they're always asked that you are mandated, required to report, but what do they get out of it? What do they get in return? Does the health department give them real-time feedback in some things that they should be aware of in their geographic area? It should be real-time information that they get back, that there are some trends within public health space that they can use to be aware of certain things, which currently, they just find out sometimes through the evening news, or sometimes it's too late. Or if they get the MMR or something, it's a print thing that comes 3 months later. So I think it's that they should be part of the caregiving ecosystem in a way that the information that if they collect all this data from these electronic systems, then they need to have a system on their end that generates information more rapidly and shares it back
with the other partners.
Because they're not like the data going from a doctor's office to a hospital or a hospital to doctor, because they're in the caregiving process. So that's a different thing.
Yeah,
they are in the process. The piece they bring to the table, if they do their job well, from a care delivery standpoint, not from the once a year health of the nation statistics standpoint, which is fine too, because that you need that also, right?
Yeah.
But on a day-to-day basis, they need to find a way to communicate information that's meaningful to the caregivers.
So can I assume then that because you understand that industry well, traditional stereotype at least was that healthcare is going to keep their shop open by not doing the preventive or population health, but it's to their advantage to have sick people. So that has shifted. I mean, from your description.
I personally, honestly, don't think that, other than probably a very small minority, that most healthcare providers let me put it this way, most doctors don't get up in the morning and say, let me find ways to rip off the system today.
Okay.
All right? I can say that categorically.
How about the hospitals?
But I think even the hospitals, I think they do want to do the right thing, but it's just that this whole the whole system has so many perverse incentives that it kind of weaves its way in a subconscious sort of way that people tend to opt, wherever there is a gray area, that they tend to opt more towards doing more than less, because that gets them actually many benefits and very little in terms of penalty, while doing less actually sometimes has all the negative consequences, including people thinking that you're not doing enough for them and all sorts of. So there's the whole system is geared towards over prescribing, overutilization of service. It's not that people do it deliberately and consciously. It's just sometimes, it gets rationalized sometimes a little bit. Yes, I understand that, but I think more or less it gets. So what I'm simply saying is that there are frustrations that providers sometimes have, which would make their job easier if the type of data that the health departments have access to, if they were getting it in a more real-time basis, that if they shared that data back, like if there's some outbreak or something, that they can warn physicians, on the lookout for this type of thing, it's been detected in your area or something, then they are being given, information that they can use to their advantage in taking care of their patients, because in the end they all want to do good for their patients.
Along with his comment, one of the things I see happening, which echoes what you just said, is really the fact that the oversight and the regulations tend to drive things versus really what the physician would like to do. So we're driven by that oversight, concern, and regulations. Requirements just there. So
I mean, the health department, like reportable diseases and so forth.
Yes.
I mean,
syndromic surveillance and
reportable. Obviously, for some infectious condition like TB or something, I think everybody understands that there's a negative consequences of not reporting that.
Right.
But some of these other things, once they diagnose it, they feel that it's just an extra burden to report it to somebody else now.
Mm-hmm. Yeah.
Okay.
Because they feel that this is just a mandate. It's not going to benefit me in any way. Because they don't get, for example, something back on a regular basis that tells them that this procedure is less effective, or this treatment is less effective, or whatever.
Or the reverse of that, this treatment is beneficial and is done
more effective. So I mean, the health departments need to figure out what is their role.
So to their defense, I would say quickly, because that's one of my research areas that I've studied, the budget cuts and the impact of recession continues on health departments. And so to their defense, smaller health departments like smaller hospitals, they say we first take care of the mandatory programs and services, and if we can find resources, then we do the additional things to them, reporting back, health informatics capacity, all those things. that are required to do that
I
are
think
like extra work.
public health has two components, right? So I mean, it's not like one thing. So
No, they have-
they have a delivery system, right? They
Yeah,
have
they have
public hospitals and
some do, but
Some
most
do.
have just clinics, small clinics.
clinics or whatever. So the public health domain, if you will, is involved in care delivery. So
Yeah, so
so
about-
all the aspects of whatever the providers have to deal with affects their providers.
Yeah, in
Then they have a more sort of regulatory
yes,
component,
they do.
as in,
Like the restaurant inspections.
reporting
Yeah.
certain, conditions, certain infections, certain things. So I think they just need to figure out what kinds of information they can provide in a more time, assuming that they get data more timely. So right now they could say that because I don't get the data in a timely fashion, I'm not able to give back information in a timely fashion.
Sure.
But if I can get data in a timely fashion, then this is what I can do in return. They have to tell the physicians what that is.
So
That is beneficial.
that
to
is
the
true. So
physicians.
if I was to put a tag on this previous block of conversation, one of the high level mandates for health departments is to promote population health. And if they can make it a responsibility or a partnership for the hospitals to do, like in other words, if they can educate hospitals and facilitate hospitals and healthcare providers about health departments needs to promote population health, then they have to
Well,
deliver that part of
the key in the promotion of population health is that they shouldn't try to either duplicate or take over
the
what the providers are already doing.
healthcare providers.
They need to find out what the gaps are
Mhm.
outside in the community and figure that one out so they can plug that gap in. That's what they need to figure
Mhm.
out.
So, so far, I think where we are going with that. But the question is, as a big brother, healthcare, what can they do, or should they be expected to do by the smaller brother, public health, which is resource poor, as opposed to the general idea of most hospitals, bigger hospitals, are not resource poor. They are relatively better off in terms of their financial situation. What should be expected? What needs to happen so that health departments can benefit from healthcare sector in partnering with them, so that they can benefit from their health informatics solutions or innovations, from healthcare solutions, and also so that they can use them as partners to advance some of their own agenda, which is not clinical care provision for public health department, but to promote overall population health. So what could be some of those things, or are there any such things that can we talk about? Or is this not?
Yeah, I mean, I think, for example, obesity is a good example. They need to find what role they can play.
Healthcare can play?
Huh?
The healthcare sector can play, or the public health?
public health sector can play.
Mhm.
That is complementary to what the providers do. See, a lot of times people start to get into things that, providers are doing already, may not be doing as well as they could, but at least that is something they normally do. But how can public health supplement that? So like there are some of these key type of things like obesity, diabetes.
One of the hospitals I was talking with, basically said, we do everything, especially with the diabetic. We can cut off toes. We do a great job of things like that, but we're not doing the training and the education and the community awareness.
Yes.
And so we do the medical side. Once they get to this problem, we can fix and do what we can to help abate the issues, but we're not doing the front end, which is really the community awareness, education, training them, teaching them what they need to do, from obesity to diabetics to,
substance abuse, mental health, all those things. So
that's where I feel the public health department needs to really pick up and start doing that education through churches and community awareness and various other schools and whatever you can think
in collaboration with the providers.
Yes.
They need to both have sort of shared goals and work towards common objectives.
The medical system's over here on the reactive side.
Right.
Mm-hmm.
We've got to get something over here, and the public health can help us with the proactive side.
Right.
Yes.
So that's what we feel like we're missing. We're just getting they're coming through.
Influence patient behavior, or influence not even patient but person before they become a patient.
So I'll close with the maybe a few thoughts from you on how can health informatics or health IT, information science, how can what role can they play?
Be a glue in the collaboration.
In communications?
With communication, with
data
flows,
transfer, okay.
and with information sharing. Data flow, communication, information sharing.
Okay.
Mm-hmm.
So if the data is flowing this way towards the health department, then information needs to flow in the opposite direction.
Okay. Makes sense.
And it also needs to flow to the
patient. Yes, all
To the
persons,
patients.
to the community, to
So
the population.
Comes here, we've got to get that out there to the education. We're not in the medical side in the education until it's too late,
Yeah.
to be blunt.
Mm-hmm.
Yeah, because the person is not assigned and attributed to them until they get sick.
Mm-hmm.
Sure.
Because the only one that get attributed are the ones that have any kind of risk-bearing population health type of payment models with a payer.
Yeah.
If you have like a total capitation per member per month type of deal with some insurance company, then you are a little bit more proactive in making sure people stay healthy. Other than that, as Mark said, everything is reactive to when people have a problem.
Yeah. And we are also, the physician market and the hospital market is under, the compliance, and they're also under what we call performance. Over here, the patient is not under any, requirement to be compliant until all of a sudden they're sick. Then they come in and they do, well, I got to diet, I got to hike, I got to walk, I got to exercise, play basketball or whatever. I got to change my diet. I got to drop potato chips and da-da-da. And so all of a sudden, if they had been educated sooner, we would start having them into better, structures.
Yeah.
Thank you for tuning in to this episode of JPHMP Direct Talk. Join us again next time for another conversation that will bridge the gap between research and practice. Learn more about public health informatics in Dr. Gulzar Shah's new commentary, Publishing on Topics in Public Health Informatics for a Quarter Century, in the 25th anniversary issue of the Journal of Public Health Management and Practice, online at journals.lww.com/JPHMP.